I think what I might just do this. I just sat on a chair at the end of the room so I can see the whole room. And I might have some heads in front of me. So I just collapsed my tripod leg, so I'm just using it like a monopod since there's not a whole lot of space. In case some of them might have to go in front of me if they have to move. I don't want to have my tripod in the way, so I just collapsed it. I just hold it on my lap so it's not quite so steady. But it also gives me a little height. This room is one of the main committee rooms. A full committee can use this room to hold a meeting, hold a public hearing, a public comment session on an issue. There's another one just like it on the other side, on the other end of the building. That will start at 1 p.m. Yep, rally is at 2 p.m. Central Time. That's U.S. Central Time, 3 p.m. Eastern. I'm not sure what the time zone might be for elsewhere on the planet. It would be a noon left coast time. I'm not sure what that'd be Hawaii time. That's a few time zones back in further, so it would be morning for them. So yeah, but this meeting in here will start at 1 p.m. Central. Was a committee meeting in here, but people are also eating their lunch in here. So again, this will be about the Medicaid privatization. A federal agency known as Center for Medicare and Medicaid Services approved of Randstad's plan, which is already in progress. And initially was supposed to go live January 1st, but there were too many issues that had not been resolved. And now March 1st is the new deadline. The idea is that 3 companies are supposed to manage the system, administer the benefits, and take the payments from the facilities, and then take their cut, their profit, and then give the rest to the state. So in other words, the state is going to lose. And so there were supposed to be 4 companies, but one had way too many problems, legal and otherwise. The other 3 have their problems also, but not as many as one called WellCare, or Well Not Care, as you could call it. So there are 3 left. I can't remember the names of them right now, but hospitals and clinics, therapy clinics, and others are supposed to sign contracts with these providers, and then individual Medicaid users are also supposed to find providers that have signed these contracts. Some may sign with only one company, some may sign with 2, some may say, we'll work with all 3. But there are many providers who have not signed the contracts. There are some beneficiaries who have not even received their information packets, which every beneficiary was supposed to get. Or there are a lot of errors on them, and they have to be redone or straightened out one way or another. I'm not sure if pharmacies have to sign on, because Medicaid, for people who do not have any other form of health care coverage, pays for some medicines. So I don't know if individual pharmacies like individual Walgreens stores or CVS stores or Hy-Vee drug stores or whatever have to sign these contracts. Hospitals have to, and if a facility does not want to participate, then they cannot see, or they cannot bill the state for a service that would have otherwise been billed to Medicaid. So it has been very frustrating, especially for those who need help with making these decisions. So people will be able to tell the committee members who will assemble here what the impact may be or what they feel about it. My concern is that if it is not well managed, if it is not well executed, then it could go down the road of what happened to the British National Health Service. I hope that work capability assessments do not make it here. And if they do, I hope they are better managed than what happened in UK. And I've seen a couple of pieces about what happened with the Kansas Medicaid privatization. That there were some serious issues with that, but I haven't seen much more. I only had a few glances, so I don't know everything that was up with that, but I hope if this is not stopped here in Iowa, I hope it does not go down the crapper like what happened in Kansas, or worse, what happened in the UK. And Harper wanted to do this up in Canada, but he got stopped. And Trudeau will not have anything of it. Yeah, I'm a little biased towards Prime Minister Trudeau, but I'm liking him more and more. He is going to be good for Canada. And he already is. And if I have to leave the U.S. because of certain political things that have the possibility of happening, if those do come about, then yeah, I'm hauling tail up to Canada. I think some of these legislators who are staying in here are on the committee who will be taking some of the testimony. Because I'm broadcasting, I personally will not speak on this, but I will definitely want to submit a comment. I'll probably ask them one of them later if there's a way to submit a comment later. I can't do that, only the governor can.
Excuse me, sorry.
Sorry, I couldn't resist. Just slinging a little bit of my weird humor. So hopefully that gave you enough of a background on Medicaid privatization. This had no input from the legislature. It was solely the governor's idea. He's doing it by executive action or executive order. And he started this thing after the last session ended in June. So no special session was called in order to deal with it. There is a bill that is in the works for trying to stop it. And committee members who will be taking this testimony here today will be the ones working on that bill. See, I'm gonna use my tablet to find the bill. Actual number of the bill. I'm actually looking for that bill number. Okay, it is called Senate File, or SF 2129. That is the number of the bill, SF 2129. Or no, it's 2125. So SF is Senate File 2125. That is the bill that is supposed to block the completion of the privatization. But if that passes both chambers and goes to the governor, he will veto it. But I do not know if there are enough votes that could override that veto. haven't looked at the full text of that bill, but after today, I think I may go dig it up online and look at it. Still got about almost a half hour before it starts, but people are wanting to claim their spots now because this room can be packed like whales in a sardine can before it starts. There's another camera over there. It looks like someone else will be shooting video. Or there was video shooting going on in here. Two local TV stations who were in that other room that I first went live in. One is Channel 5 from here in Des Moines, and then the other one was a Cedar Rapids TV station. I think that one might have been Channel 9 from Cedar Rapids. No, that's I don't remember that other channel number, what the number of the channel is, but KGAN from Cedar Rapids. And WOI Channel 5 from here in Des Moines. But they like to go by the phrase "we are Iowa" instead of using call letters. talking with some people. Just a conversation while we wait for this thing to start. There are even some people sitting in the middle of the tables. Someone wants to go behind you. And for those just joining me, this is Occupier Caitlin. I am live in room 116 in the Iowa State Capitol, one of the main committee meeting rooms. At 1 p.m. Central, there will be a public hearing or public comment held by the Human Service Committee on the Medicaid Privatization Bill, SF 2125. It's Senate File 2125. And that bill is designed to stop the completion of the privatization process and to reverse what has already been done. Cancel all the contracts that have been agreed to already and restore the original Medicaid system where it was executed without the middleman, so to speak. This middleman would take their cut of the money that the state pays for providing the Medicaid service and for administering the program. Which in the end would cost taxpayers more because the state is paying its contractors a certain amount, and that could in turn jack the copay and other out-of-pocket costs for the users of the system. Worst case scenario, all you'd have to do is look at the British National Health Service and what happened to it. Ask any UK citizen, they'll tell you what has happened to them personally, because it has affected so many what has been done there. And conservatives want to gut it even more on the backs of disabled children, disabled adults, the elderly, and other poor people who do not have the ability to find work. So there will be providers testifying, There will be users of the Medicaid service testifying. There will be relatives of users who are not able to speak for themselves because of a disability or who are just not able to be here. And then other advocates representing organizations that work with disabled people and just other concerned citizens. They will be giving their comments using the table mics, which are all connected to recorders that record all these sessions. Looks like the other end of the room is all cleared out. The caterer has taken their stuff away. They did that several minutes ago.
Yeah.
Those others who have just now finished their lunch are disposing of it. So earlier I was upstairs showing you the lobbying that goes on. Showing you the process of how that goes. I'll save her chair for her.
Oh, thank you.
Yeah.
That was risky business, wasn't it?
Well,
You're stealing my chair. Yeah, then she saved your chair. Oh my
that's why I put my tablet down there. So,
I got up. I should have just said my first.
just taking a few pictures of the room before my view gets blocked. When the committee members return. When I go out of this room onto the main area and back into the rotunda where the rally itself will begin, I'll be shooting more pictures. And I'll put those up on my Facebook page later. And then when I get home, I will put my video from today's stream up on YouTube. So it will be archived there. Posted not only on the Facebook event page that I'm streaming today, but I just posted that on my wall and I tweeted it. And Ustream will hold this for 30 days. Then it will dump. I do not have a paid account where I could store on their servers for longer than that. But that's okay because I put it up on YouTube. And that's how I archive them there. I wish I would have been able to do that when I had on my, when I was using Justin.tv for my streaming before I got into using Ustream and Bamboozle. So when although I found the Justin app, I downloaded it, but I can't log in or create a new account. So the app is still available, but the service itself may still be down. But who knows? Maybe someone will bring it back. I don't know. And it looks like some of the community members are coming back in. Still got about 20 minutes before the hearing is supposed to start. So as you can tell by the number of people in here already who have been in here for even longer than I have, that there is definite interest. But many more are interested but who are not able to come, as I saw in the comments on the Facebook event page. So I knew I had to live stream it just for them, as well as archive it. So that camera is still over there. I don't think it's live yet because I haven't seen anyone go up to it to actually start it, but it is set up. So that guy is, I think, the owner of that camera, so he'll fire it up when he's ready. But I've been live since 10 o'clock this morning. Yeah, you want to put something down on your seat if you get up, otherwise someone will nip it. That's why I threw my tablet down there when she got up because I wanted to save it for her. And that's my kitty, by the way.
Oh, very cute.
Her name is Mila.
Very cute.
She's 11 years old. And all goof.
Someone put on Facebook and they took the seats and chairs, they took the legs off, and then put it on the wall so the cats could perch and climb.
Yeah, I have seen pictures of shelves just scattered all over the walls where the cats would go.
Like cubbies.
Yeah. I have not done that for my cat, but I have boxes everywhere because she loves boxes.
them,
Yeah, she loves boxes.
So are you live now?
Yeah.
So how does it work?
I have an app on my phone.
Okay.
I also have the apps on my tablet, and I fire it up, and it uses Wi-Fi or mobile data.
Okay.
So I'm pinging off the Billings Wi-Fi,
Yeah.
and sometimes I use a hotspot to try to get my signal strength up, and basically doing a live broadcast just like a bigger TV channel camera,
Okay.
but I'm just using the mobile network.
Okay. So you're hired today? Are you hired today through providers like Medicaid? Or is it
No, I'm totally freelance.
got it? Okay.
So I go to protests. I go to, so this Monday I was at the city council.
Okay.
So I live streamed that.
Okay.
And I've been here before, for different things. I went up to St. Paul, Minnesota last summer for a big march against pipelines.
Okay. Yeah.
And I'm involved with the Back and Resistance Coalition. So I am involved with that,
All right.
trying to stop that bit of stupidity from crossing the state. I mean, we got enough issues with the 726 polluted waterways. We don't need any more.
Now, did you find a plug-in? Are you plugged in?
Yeah, to a power pack.
Oh, okay. Yeah. Sorry, that's right.
That thing.
Well, that's a big one. Oh, okay. Do you like it?
Oh yeah. So I can stream longer, and it extends my battery life.
Okay. What brand is it? You know?
This particular one and another one that I have is Power Bank.
Power bank. Okay.
Yep. And I got them on eBay.
Okay. I'm rather attached to my phone.
So they're also good if you are in an area that is prone to power outages,
Oh, I'm not. But okay.
or if you're going to be traveling and you don't have a means to charge in a vehicle,
Right.
you could do that. Or if you use it for work and you have to have lots of power and you don't have spare batteries, or you have an iPhone.
Yeah, and that's rechargeable, right?
Yeah. So what I do is I plug it into a computer,
Oh, okay.
and I charge it overnight,
Yeah.
and then in the morning it's done charging and ready to go again. And this is a hard case that it's in. It's water resistant. It's got seals, and the phone itself is water resistant. It has a seal on the back,
Okay, that's fine.
and it's a Samsung Galaxy S5.
Okay. Well, it's supposed to be 116. Yeah.
It's a tight squeeze in here.
It's cozy.
Yeah.
It's like
That-
when they have those in, you know, when people are selling houses and they say it's cozy. That's
Yeah.
that's
Just
what
their
it
way
is.
of saving on the heat bill.
There you
It all
go.
closed.
There you go. A little camaraderie.
So that was a cameraman for one of the TV channels coming in here. He is he's going to set up over there next to that other camera. And he has his tripod set up in front of a chair, but please keep in mind I just have the top part extended up, and I have the legs collapsed. So I'm using it like a monopod, and I just holding it on my lap. So it won't be as steady as when I have it set up on the floor. But, it actually gets my phone a little bit higher than it would if I were to stand it up on the floor. He is making sure all the mics are connected. Yes, so we're going to find another spot. Maybe they'll have to shoot from the door. So the way these mics work is there's a button that you have to push to turn the mic on, and a light comes on that indicates that it is live. And then when you're done speaking, you push it to turn the mic off. So right now they're angled down at the TV. And then legislators will simply angle them up when they're ready to begin. So I just want to give you a good shot of that before my view gets obstructed. So I got a person in front of me. So that's what those things are there. And they are connected to a recorder. Well, it is 1 o'clock. I'm not sure how many legislators will be in here. There are people standing in the door. I think they're waiting to look for us. I don't know if this will be a full committee or just a few members that will be running this. We have already had the first legislative funnel.
No, I don't.
Which means that bills had to be out of committee and down on the floor of the full chamber for debate and voting. And then the second funnel will be cross chamber, where the bills have to be out of the other chambers committee and onto the full floor. Say a House bill that goes over to the Senate, it has to be out of the Senate committee and on the full Senate floor for debate and voting. The exceptions to the funnel rule are all budgetary bills.
Maybe Russ, does Russ here?
And similar administrative type bills that those are the only exceptions to the funnel rule. It's a way of whittling down the number of bills that chambers can act on. Although some bills don't even get it out of a subcommittee. The subcommittee may kill it before it even gets to a full committee. And then it is dead until someone brings it up again later. Sometimes a bill that could be thought to be dead could be brought up again under certain circumstances. That gets a little complicated, and I don't know the whole process on that. It has happened. And then there can be special sessions that can be held. Like 4 years ago when I was here for the education reform bill, I did not stream that, but what I did was I wanted to testify on behalf of my sister who works for the school system. And that was in October. So we were all in the House chamber, and I was reading the bill, waiting for my turn to speak, but they only took up to 70 speakers before the full House adjourned. But then some committee members took additional testimony afterwards in one of these rooms, and so I went in along with about 15 or so others to give a testimony, and I spoke on behalf of my sister who does special ed. So that was in October. That was a special session. And then there have been special sessions on other issues. So that was a rare thing for the full House to be in session in October. Usually they run January to it's supposed to end at the end of April, but last year it ran till beginning of June. And still not much got done because a lot of bills were defeated that would have been good for Iowa, and some that were passed that are not so good. Looks like the rest of them are ready to take their seats. The rest of the committee members are coming in. There are still some people standing there at the door, over there and over there. Yep, I knew he'd be shooting from the door.
That's right.
It's a little tight squeeze right here.
Your constituents will know your interests.
Stand in front of everybody.
Yeah, hold up a wall.
Or it's holding up me.
Yeah, yeah. Oh, she's gonna guy who's going to just be shooting pictures. So it's a late start. Okay, go for it. Have fun. Now this part should actually be interesting because you'll get to hear individual stories about Medicaid privatization. You can go in front of me.
I don't want to block your view.
Nah, that's okay. If you go in front of me, I don't care. It hasn't started yet anyway. It looks like we're going to have a packed house.
Yes, it is a packed house. Very much so.
To speak. If you have not done that and want to, Senator Bolton's got this. Raise your hand.
I was taking some more pictures.
I had no good idea of how to do that. So that's kind of like where we're
She
at.
has the
We are
red,
waiting for two more members of the committee,
red light
Senator
on.
Johnson and Senator Segabar. And as soon as they come, we will start. Okay? Raise your hand if you want to, or maybe who's got the sheet there?
It's probably just going around the room.
Okay, so maybe we move it this way and.
Sorry. So there is a speaker list already, and the senator is taking additional speakers, names, who will speak to this committee. They probably will have a time limit of how long this will last. If they can find another chair. They will use that mic apparently. So those two empty chairs are for those who will testify, and if a person in a wheelchair comes up, then the chair will simply be moved.
I have the other names that are on deck. So Karen Butters, if I threw in your name, I apologize. Muellers, okay, Karen Muellers, Don Dew, Cynthia Strauss, Jeff Edward, Steve Yeshiva from Systems Unlimited, Kelly Ramos, Linda Levy, and Rima McQuaid, Jeff Lauer, and Roxanne. So those are the orders that I have. So if you, and the sign-up sheet is going around somewhere here. Yellow bag.
Yep.
Okay, so there it is. There are some hands raised in the back. Because we have a short amount of time, we're going to just get right into the nitty-gritty. Despite the disappointment we had yesterday, we realized that more than ever we need to have an oversight bill moving forward. There will be an amendment that's passed out, and it will be on the web that what it does is not a lot of much different to the bill, but it just makes it tighter. So you're welcome to look at that and make comments and let us know after this meeting. Senator Johnson, who is also on this, and Senator Sigabart and Senator Mathis and Senator Bolton are all aware of the amendment. And so we'll continue to have this as a work in progress. Thank you all for being here. Senator Johnson would like to make a comment.
I just want to make a brief comment. Thank you, Madam Chair. Thanks for everybody for being here. But let's have a medical report on here, please. It's a very emotional issue, we know that. But let's let the people speak. Roll call. I know you want to, but let's just hear as much testimony as you can. Thank you.
And on that note, because we have such a large group of speakers that are interested, if you could limit your comments to 2 to 3 minutes, that would be so helpful because I know it's a lot to say in such a deep subject, but go ahead.
Hi, this is Anna Whittle. Welcome to, I'm glad to be here. My sister, niece, and granddaughters are all Medicaid members. My niece, she cannot find a doctor since she moved back to Cedar Rapids in December. She has been looking for one for over 2 full months. She has even solicited the help of a local Find a Doctor service. With over 250,000 people in the Cedar Rapids metropolitan area and not being able to find a doctor is really heart-rending. And it's just not alone. Some providers have stopped accepting Medicaid that have been accepting it, and I know people are calling their doctors because of that now. And this is just one small problem in a sea of issues that the program has not even started yet. This and countless other issues are the reason that we need an individual oversight committee that deals with nothing but the issues this Medicaid privatization is causing and will cause in the future. I know that there will be countless issues to come based upon the reports of the states that our governor touts as success stories. These so-called success states have encountered massive amounts of Medicaid denials after the first year of oversight is over. The amount of help the Medicaid members will need will completely overwhelm any existing oversight committee. This is not fair to either group, the one that's getting the Medicaid, or the staff. This is why Medicaid will need its own oversight committee in place by April 1st, with the needed 134 ombudsmen to cover 560,000 people. This is a figure of 4,179 people per ombudsman. That's a hard word for me to say. Would any of you want that job?
The ombudsman is an advocate who will assist a complainant with issues regarding a state program or service.
Family members, beneficiaries, and providers involved. Thank you very much.
Hi, my name is Ron House. I'm from Marion. Thank you so much for letting us come and speak with you today. I've been following this issue very, very closely since last spring. And I really appreciate all of you and your support in this particular issue. I do want to encourage you with the oversight bill to really push for a very comprehensive, a very robust oversight bill. There's been discussion from various legislatures and public comments, possibly using an existing committee of some type, such as the MAC Council. And I really want to encourage you to understand that that is not adequate. This is one of the top 2 expenditures in the state. We're talking about over 500,000 people impacted, and it is that important and that do also want to suggest that with an oversight committee, it should be nothing about us without us. It is very important to have beneficiaries, family members, and providers to have input on us to that committee. I think we've got a group called MCO Watchdog on Facebook. We have been
It's
extremely
MCO Watchdog. Watchdog is one word. There's a group on Facebook. I am in that group.
We can rise to the challenge of being a member of such oversight committee. So please include us.
So MCO stands for Managed Care Organization.
As far as we are without all of us that are in this room, you're what brought me along first alive. So, the next two are Karen and Don.
My name is Karen Muellers, and this is Derek. We are from Seacrest, Iowa. I have three of my children with me that are beneficiaries. 9 of them are beneficiaries. They're adopted children with me. We've had for practically for most of them. And we're very concerned about this situation. And I'm here to maintain that we still are in the dark about so much. Even though CMS has shared that the NCOs have made some improvements, we as beneficiaries have yet to see it. I just learned today as I was coming down here that we finally got letters confirming that my 9 are indeed accepted with the NCO that I requested. In the beginning, they were all across the board. They were not under the same NCO. And we're trying to communicate with our case manager and the NCOs, and we're still getting in our providers, and they're still saying to us, I don't know, we don't know how that's going to work yet. And as one of you shared, would you buy a car or a house this way? And there's 560,000 people in Iowa that are being forced to accept this program without knowing the terms of the agreement and how much they're going to lose or how much they're going to have to pay. And we just really earnestly need to have an oversight committee to help monitor this program as it goes on. And yes, it does need to have all kinds of people representing all of us.
Thank you for your time very much. Don?
Good afternoon. My name is Don Jew from Disabilities Resource Center, Sioux City. I am a beneficiary of Medicaid. And I would just like to have an opportunity to give you a few comments. As you all know, oversight is usually something that is in all policy, but usually it's done at the forefront, not at the back end, like we see now. I have very many years of experience doing Medicaid research and analysis in states such as Kansas, as they were switching over to managed Medicaid. And
Again, Kansas is another state that privatized its Medicaid system.
So the horse has gotten out of the barn and now we're trying to close the barn door. But that doesn't mean that we have to stop. When I did research and looked at policies, I looked at 2 things to see whether they were good policies. And number 1 is, does it have consumer participation? Which that will get me to the back end. Number 2, who handles the enforcement of an oversight policy? We haven't heard anything about the enforcement. There has to be teeth if there's enforcement. oversight policy without chief, what incentivizes a governor or a senate or anybody to even go along with it? And that brings me to the Medical Assistance Advisory Council for the Act. We have that right now, which is a CMS suggested policy, which now is the state statute. Our state statute says public representatives should include members of consumer groups, including representatives of medical assistance, families, consumer organizations, and others, equal in number of the number of representatives of the professional entities. Currently, there's one consumer, 3 of the public organizations. The governor finds that fine. I don't know if anybody else finds that fine. There's 33 vacancies that are not being filled. My representatives have had contact with the Attorney General for an opinion. Since November, they have not made an opinion.
And we addressed some of that in this
I
legislation.
see that.
So,
But there also is, where's the team? And that's where there has to be something more. There always has to be something more.
Enforcement could be if if a
a
beneficiary is denied something which normally should be approved, or if the state refuses to pay for something that it should pay for anyway.
Thank you for your comments. Cynthia and Jeff, Jeff Edgar. Jeff, why don't you go ahead and start?
Thank you.
Doesn't matter.
Thank you for all the work, senators, that you've been doing on behalf not only of my I am directly affected. There are hundreds of thousands of people indirectly affected as well. Care providers, families, friends. This is an important issue. If there are 3.5 million people in Iowa, this is 25% of people that are affected directly and indirectly by this issue. I am the father of a disabled child. He's profoundly disabled. He is a sweet. His nickname in school is Charlie. And just call it. And he lives at an intermediate care facility. They do a fantastic job. He feels safe. I've asked him. He calls it home. I've asked him that too. And with this issue, Colin is not able to survive in the world without 24/7 care. He would not live one day if he was sooner. So this is a very important issue for me. That I called my MCO about prior approval and some other details, and they said on April 1st we can give the answers. We can't give the answers before that. We don't have the staff. I said, what happens when it's only April 2nd? And they didn't have answers before that. So after that, I called Iowa Medicaid Enterprise and was told by IME that the only difference here is that there's a name change from Title 19 to MC. I got worried at that point, and I said, I've downloaded and read all the good documents. If there's anything I could possibly do on this issue, I don't think that's actually true. And the IME worker maintained what it was, and I said, would you send me a letter telling me that you won't send my son out the door on April 2nd? She said, well, we won't do that, Mr. Edgar, but I can't play that. So we need oversight. We need some redress for this. This is an important issue. This is not statistics. This is not Republicans and Democrats. This is not Congress and Senate and administration. This is people. And they're important people. And maybe better than what we're offering. Maybe they're
get closer to the microphone, just because we have people out in the
Okay, is it
area,
better?
so they can't always, that was better, yes.
So I pretend to speak like this, so sorry for everybody. Hi, my name is Cynthia Chavez. I'm almost 22 years old and been a Medicaid beneficiary for about as long as I can remember. I'm here today as an advocate as well as a beneficiary because the practicing of Medicaid affects me and hundreds of thousands of others, 560,000 to be exact. It's something that needs to be talked about. Iowa Medicaid managed care is a huge mess. From the ludicrous speed at which this has been so very rudely thrown in all of our faces, the fact that it's been almost 6 months since packets have been started being mailed out, yet my best friend still has not gotten her initial enrollment packet. It was also told she couldn't be found in the system. It is mandatory that this process be looked at thoroughly with common sense and with the people in mind, not money or partisan politics. This whole thing is flat out ridiculous. My mom, Rhonda Shaw, put our bus trip today together with some help from all those from the MTA Watchdog group who are here today and more. We are the people impacted, so it is we who deserve and should be allowed to have the main say what happens to us. After all, it is we the people. Thank you.
Thank you. Steve, Toshiba, and Kelly. Well, go ahead and just start that time.
These companies need to be watched. They need people like us on committee. They know, they know more about making money than they know about us. We won't stand a long oversight. Thank you.
Thank you.
Hi, my name is Kate Woman. I am 28 years old. I live close to the group home in Iowa City. I use a motorized wheelchair as I don't know if I can say that. But things need to slow way down as fast as these companies are things need to slow way down as fast as these companies trying to take over our Medicaid. All these companies are about all these companies are trying to take over our Medicaid. All these companies care about is profit. They should care more about the people's well-being. Companies need to stand alone and oversight. I have at least a dozen different doctors. I'm positive all the doctors aren't signed up with the same providers. And I need all the doctors. I also have certain medical supplies I need, and I need the best ones available. Also, my staff get paid through Medicaid. Without Medicaid, I will lose my place to live and my staff. I need help, or I need them to help me do everyday things. Please don't take my rights away to live my life
just so people outside can hear.
Okay. My name is Linda Levy. Members of my family are currently on medication. I've never publicly advocated for an issue in my life. I'm just amazed. I'm not even, I have all these prepared things to say, and just being here, look at all these people. They need help. I'm average means, I can get around and do things. With my son, I have to take cars. But how many people are mobile? They have absolutely nobody to advocate for them. I am so proud of everybody that's here. We made so much progress in getting this building so that work can be done to make it go more smoothly. I hope we can continue to do that. And I think a strong oversight committee with all of these people involved and all of you involved, helping each other cooperate together to make something that really is beneficial for everybody, not just for a financial bottom line. So I really appreciate being here. I really appreciate everybody here is so proud that you're here. I'm just totally impressed. So all my talks are out the window, and I really want strong oversight. All these people need to be involved. Thank you so much for all of your
Hi, my name is Kelly Ramos. I represent 3 biological children, or 2 biological children of my own, one that has been adopted, and I'm also a provider, and my client lives with my family. I'm just going to go to basics. Trust. That's the belief in someone or something that's reliable, good, honest, and effective. Integrity. Adherence to moral and ethical principles. Soundness of moral character and honesty. Character, a set of qualities that make a place or a thing different from any other place. Quality, a high level of value or excellence. Accountability, an obligation or willingness to accept responsibility. Disability, a condition that damages
I thought that there would be a meeting at 10:30, but now that it turned out to be something different, there's just gathering of people who would be participating in this hearing and in the rally that will come at 2 o'clock.
Many of these issues have been broken. The people of Iowa, 560,000, are pleading for some kind of oversight. I did a little research. 2 of my children, well, all 3 of my children that have Medicaid, have all participated in the Children's Mental Health Waiver. Last night, out of 199 pages that are listed on the IME website, only 177 showed up. I was looking for the dollar amount. With the CMH waiver, $1,967 goes to that client or enrollee. Of that, if the enrollee does not use it, they lose it. Currently, if I don't access all of my respite, family and community supports, in-home therapy, home and vehicle modifications are all part of this package. And again, it's a use it or lose it. It's the only waiver. We have 8 waivers in the state of Iowa. With this particular waiver, how it works right now is if I don't use these services or these monies, it goes back to Medicaid. I cannot find an answer of where this money is going to go with an MCO. Does the MCO get to profit from lack of services because our rural communities don't have respite providers? Or in-home family therapy? Or is the MCO going to send the money back to the state of Iowa? We have no answers on this. It is critical that we have an oversight committee that meets the criteria of trust, integrity, character, quality, accountability, understanding disabilities, and creating a partnership that is successful. My kids, all they want to do is grow up and be working citizens within the state of Iowa. That's their goal. Isn't that everyone's goal? Thank you for the time to speak.
Thank you. And this legislation, we address that very issue that you're discussing right now. Thank you.
Thank you very much.
The next two, let's see, Rayma and Jeff Lauer.
Rima McCoy McD, Executive Director with Central Iowa Center for Independent Living in Des Moines. At CISL, we are people with disabilities serving people with disabilities. And 30 years ago, I was diagnosed with autism. Fun fact. I also tend to run at the mouth, so instead of me doing that, I'm going to share some words of wisdom from the Texas Medical Association. Recently, some advocates and medical ethicists have appeared who argue that the Hippocratic Oath and physician's fiduciary duty to the patient are outdated and obsolete. They argue for a new ethic that directs the duty of the physician to the group, the entire population of patients, rather than to an individual patient. Their new ethic would replace the timeless one discussed by the Council on Ethical and Judicial Affairs of the American Medical Association in its paper Ethical Issues in Managed Care. There is something frightening about this new ethic that should alarm every advocate for individuals with disabilities. This new ethic is marked by an excessive preoccupation with efficiency. It sees the elderly and individuals with disabilities as intolerable and too burdensome for a vibrant society emphasizing prevention, wellness, and health maintenance, armed with cost containment and utilization review policies, and with statistics and standards of practice based on cost averaging and of best case scenarios, rather than with medical knowledge. It considers individuals with disabilities as marginal humans whose health can no longer be afforded by the nation. But that is just what the genius of the ADA prohibits, and the Congress intended to outlaw
ADA
with the
is
adoption of the ADA.
Americans with Disabilities
the ADA demands
Act.
that individuals with disabilities be free of discrimination based on their disabilities, and that they be treated on a case-by-case basis. Not that they be lumped together in broad categories so that the most expensive or the most burdensome can be excluded from the mainstream of society, be denied health care, education, or employment, or be deprived of their most vital relationships. My question is, how are we going to do this the Iowa way? Because this does not sound like the Iowa way to me. And the only way that I think that we can do this is with the robust participation of Iowans with disabilities, their parents, guardians, and advocates, and providers. Thank you.
Thank you. That's good to follow up on that. I'm Jeffrey Lauer. I'm a former director of chapter of the ARC of Iowa. Currently serves as the executive director of the Brain Injury Alliance of Iowa, also on the Iowa Homestead Committee. Medicaid's been an essential safety net for more than 50 years, since 1965. A number of years ago, the Patient Protection and Affordable Care Act, the ACA, added millions of Americans onto Medicaid, providing insurance for people who hadn't had it for forever. Iowans with disabilities and their families who depend on Medicaid have enjoyed that coverage for many, many years. However, persons with disabilities in Iowa and across the country have needed and have used, in 2011, for example, up to 49% of Medicaid expenditures. People with disabilities need and use an inordinate amount of Medicaid services and supports. It's just something we know. We also know that the data from other states who've crossed the bridge and gone down the road of managed care have been able to save money with managed care through two primary ways. One, they reduce the amount of money that providers get for providing services. And two, they reduce and decrease access to services for people. The people who depend most on those services are the 500+ thousand people that we're talking about, are the 150,000 Iowans who stand to be at the most vulnerable apex of this transition. So what I want to do, and to follow up on a previous comment, is talk about really 6 key points that this process that you're moving forward on, Senate File 2213, has to ensure, as well as your future efforts,
2213 is a companion bill to
is available, is appropriate to people with disabilities, acceptable
the other one that
to people with disabilities,
was mentioned earlier.
to people with disabilities and the providers, and is accountable. Let me just quick run down again. Accessible. There have to be providers within a reasonable distance. Transportation has to happen, otherwise people don't have access. And information about how to get access has to have oversight. We have to make sure that information is appropriate for people in the different ways that they need it. It has to be available. There have to be a sufficient number of providers. We know the Medicaid transition to Medicare was delayed, in part because of an insufficient provider network. It's going to happen now on April 1st. We also know that availability is not there right now for people on the waiver waiting list for Medicaid. There are more than 10,000 Iowans waiting for waiver services through Medicaid for more than 2 years. And the other availability piece that I think that there's been some movement to deal with is, for example, the services themselves, therapies for kids. There have to be accessible services in that way. They have to be appropriate. It has to be the right kind of care for people with disabilities and other people on Medicaid. Specialists have to be available and accessible. And the appropriate specialists have to be there. Acceptability. The services have to be patient-centered. We say that and person-centered all the time, but it's harder to do than to say. Culturally competent, conflict-free. Affordability. We hear a lot at the State House that Medicaid is becoming unaffordable. Well, we have to make sure it's affordable to people with disabilities and people who need Medicaid, and affordable for providers to provide those services. In some parts of the state, people are going out of business. Lastly, accountable. We have to ask you to be in this for the long haul, not just Senate File 2213, but to maintain that accountability over time. Thank you.
Just for anybody who delivers any comments, if you would like to give us handwritten comments, we would appreciate those afterwards. We're trying to jot notes down on all this, and it is, extreme.
I'll send you my
But
6
it would be really great. You had great comments as well, and others that have. So if you have hard copies, that would be really great. Or email them to us.
We'll do it.
So thank you very much. Roxanne, you're up next. Here you are. And then the next one would be Daniel. What's back there?
Good afternoon. Thank you for introducing. My name is Roxanne Coble, Director of Iowa Epilepsy Services for the Epilepsy Foundation. Thank you for introducing this oversight bill for Medicaid managed care. It is critically important to track and report the outcome of individual requests and maintain transparency and accountability in the Medicaid program. 1 out of 100 people live with epilepsy, and 1 out of every 26 people will develop epilepsy by the time they will reach their elderly years. And 1/3 of the population of people with epilepsy have seizures that are uncontrolled, which are intractable. Medications are the frontline treatment for managing seizures. It is important for individuals with epilepsy to access their medications, treatments, specialists, therapies, services. It is all very critical. It is also important to make sure that the state preferred drug list stays intact, and to make sure it continues to be managed by the state and not by different entities. Minimize step therapies and other restrictions implemented by the managed care organizations will decrease the barriers and work for people to access their medications. Whenever physicians prescribe medications for patients with epilepsy, we can't have failed curves in step therapies. They are increased barriers for accessing care. It is also important to equip the long-term ombudsman group with the additional resources to handle the increased volume of calls that they will be receiving with the managed care program. And lastly, we ask that you please consider adding the Epilepsy Foundation to the list of entities to serve on the council as a voting member. Thank you for your time this afternoon.
My name is Daniel Britt. I represent the Iowa Occupational Therapy Association. I also work at Northern Iowa Therapy. We have 150 providers of occupational therapy, physical therapy, and speech therapy throughout rural communities of Northeast Iowa. I wanted to first talk about our difficulties or challenges with the Hawkeye program. On January 1st, the Hawkeye program, our speech therapy, transitioned away from Blue Cross and Blue Shield being the administrator of Hawkeye to United Healthcare. And we found out that United Healthcare would not cover speech therapy for common childhood diagnoses. So we found ourselves turning people away, people were discharged. We later found out that United came back and said we would honor the Blue Cross and Blue Shield pre-authorization. So we thought golden. But by that time, these authorizations have already expired. So again, we are still turning people away. That was not a fix for that. Secondly, we said in claims that United said they would honor the pre-authorization. All of these claims have been rejected. We have met with leadership from IME, Sean Bagneski. We've met with leadership from
IME is
United
Iowa
Healthcare,
Medicaid
and
Enterprise.
Both sides of the aisle, Republicans and Democrats, were setting up meetings every 2 weeks with Iowa pediatric therapy providers. And at that meeting, Sean asked leadership from United to set up a point person to help with all of these denied claims. United Healthcare refused to send up a point person. They said that they set up a point person. They cannot measure call metrics such as the waiting time, etc. And I think that refusal speaks volumes to an MCO's commitment to making this work, to working with providers, etc. So we do need leadership for this. And I get that we have to balance the budget. I get it. There's a lot of things that need to be covered. There's a limited amount of money. But as providers, we need answers. We need clear answers. And we need some oversight just that has some teeth to make this work. So speech therapy was the first canary in the bird cage. Starting April 1st, occupational therapy is the next canary in the bird cage. So with occupational therapy, they go live with Hawkeye, with the MCOs April 1st, with the 2 MCOs. United Healthcare will cover occupational therapy, but the other 2 MCOs, one will not cover it, and one only covers occupational therapy for the upper extremity. So now we face people coming in. If you need occupational therapy, you go this MCO. If you need physical therapy or speech therapy, you go this one. If you need
It would not cover occupational therapy for the lower body.
When Blue Cross and Blue Shield wasn't. So we go to all these meetings saying benefits would not change. I have very specific examples of benefits changing, and I would be happy to share those with you more in detail. Secondly, when we go on to the United Healthcare website, you bring up the manual. We have therapists listed as being providers for United Healthcare MCO. We haven't signed the contracts with them. How are our providers on there? So they've taken the community healthcare, because we do have providers on the community one, non-MCO related, and they've transferred that to the MCO website. So people in this room, if you see providers with United Healthcare, you think golden. That's what we got patients coming golden. I think United, we're not a provider with them. People look at us perplexed. They don't get it. So, and on behalf of Iowa Occupational Therapy Association, we have many other pediatric providers taking this. It gets more money yet. Under MCO, our entity, Northern Iowa Therapy Associates, is an institutional provider. We do not credential each individual of our 150 providers. With United Commercial, they won't recognize our institutional status. We individually credential. So how are these individual names getting on to the MCO website? So these numbers are coming out. X percentage of providers in Iowa are signed up with the MCOs. It's a mess. It's a beehive. And I don't even know how to sort through it.
I would call it a hornet's nest, not a beehive.
We are a rehab agency under Title 19 and institutional provider. We have specific coverage requirements. Our coverage requirements are not subject to an annual cap that a therapist in private practice has. All 3 MCOs, if you look at the provider manuals, it says all occupational, physical, and speech therapy are subject to an annual cap. We've been going back and forth for months with MCOs about this. I even sit on the MAC Executive Council on behalf of IOTA, and I can't get an answer, and I'm on the council. So how can other people get an answer? United Healthcare has finally come back and said, yes, we will recognize your institutional status. I can't get answers from the other 2 MCOs. We've gone through Sean Bagneski, we've gone through proper channels, and we're not getting a response. We need oversight just to get clear answers back to our specific questions.
Next, the committee needs some teeth to get answers back. From my experience with this, we've gone through proper channels, and if no answers come back, there's no consequence. I don't know what that involves, if it's a report card, if it's fines, etc., but there needs to be accountability back. In closing, I get we have to balance the budget. We have to do it smarter. We have to figure this out to provide a population of people with the best care possible. But I'm telling you, we as providers need clear answers, and we are not getting them now. And we beg you people at this table that have some teeth to make this happen so we can get clear answers and provide the people in Iowa the care that they deserve. Thank you.
Thank you. The next is Patty Bowl, state pathologist, and Carla Nancy. Go ahead, you push the button, there you go.
My name is Patty Bowl. I'm a speech pathologist that serves children who are on Medicaid. I'm also a parent of a 31-year-old special needs adult son. And the thing that I'm probably the most concerned about, there is no continuity between the three companies. And as far as covered services, so how do you know which to choose? Because as they stated, other individuals have stated before, the benefits vary. So basically, Medicaid is gone, and it's gone to just private healthcare companies. There is no longer Medicaid in my eyes. Just to give a couple examples of things that can be a nightmare. My son gets transportation to and from work. What could possibly happen, our caseworker has indicated, is that he will have company A take him, company B will pick him up. Tomorrow, company C drives. I have no idea who to call in a snowstorm to find out where is my son Ryan. And he's someone that likes to be on time. Anyone who has a child likes routine. There's no routine with this. As a provider, the pre-authorization, how long is that going to take me come April 1st? Do I go on vacation for 30 days, 60 days because I can't work? And then do my patients have no services? So that is a huge concern. I think most people have expressed great concerns here, and I hate to see these wonderful benefits that are on people with disabilities no longer exist.
Hi, I'm Carla Fancy. I'm from Mason City. I don't have any numbers to share with you. I'm a parent. My son is in a better situation than a lot of his peers. He does have private insurance. And I'm here to speak on the benefit of other parents. I have two friends whose children are special needs. Both have seizure disorders. Last week, one of the parents went to refill the child's monthly medication. $2,000 copay.
Ouch.
$2,000 for all the medications for that one month.
And that's just a
She's a
copay.
young adult. She's 26. She gets disability. She makes in 1 month $1,500. That's it. It seems to me that we're coming down here to a choice of, are we going to get the medications, or are we going to allow this individual to live? Really? Is that what it's going to come down to? Is it Iowa's way of saying, yeah, you're not welcome here because you have a disability? These individuals, the disability can vary from mild to severe. My son is autistic. It's fairly mild. Hopefully he'll be able to get a job. And he will become a productive member of society. But my friend's children will never be able to do that. My other friend, she has a 15-year-old daughter. She called all of the MCOs to figure out the formularies for the medications her daughter takes. What it came down two is the copay would cause her to lose her home. No home for the parents, no home for the child. What kind of message is Iowa sending to your population members? It's a touchy subject. I wanted to speak from the heart because this just brings tears to my eyes. And I'm thankful that my son's not in that boat, you bet. But I can't help but feel for these other people. And I'm proud to be an Iowan. And right now, I'm telling you, I'm not so proud. I don't know what the answer is. I don't sit where you all sit. And I do thank you for all that you've done thus far, but we need more. We need more. Something has to happen. Something has to be done. Because this is not working out. It will not work out. I had one of the parents 2 days off from work and spent it on the phone with the MCOs and IME trying to figure it out. And guess what? They did not correspond. Somebody's lying, don't know who it is. These parents also take their children to Minnesota as part of their care. They see neurologists, one at Mayo Clinic. She took her daughter up a month ago to see the pediatric neurologist at Mayo Clinic. Does anyone have a guess how long the waiting list is at the University of Iowa Pediatric Neurology Clinic?
About 2.5 years.
Yep.
You told me that already.
Yep. Her daughter came in 2.5 years without seeing a neurologist. She has a seizure disorder. Neither parent can let their child go that long. And the neurologist at Mayo has enough patients from the state of Iowa who have Medicaid. She point blank said there is no way the University of Iowa is going to be able to absorb all these patients. We don't know what's going to happen. So we're looking towards you as our legislators to help us with this situation. We're placing our faith with you. These are our children, and you know what? These children could be your future, your grandchildren's future. You really could. You don't know what some of these kids may be capable of when the time comes and they grow up. Thank you for your time. I do appreciate it.
Thank you. The next two are Shelley. Kirsten Phillips and Shelley, is it Jasper? There you are.
Okay, I'm the loser, right? Sorry. My name is Shelley Jasper. 10 years ago, I had an accident and I ended up quadriplegic. I had no idea. I worked almost full time since I was 15, and I didn't know I was going to be able to go back to work. I didn't know how I was going to live. I didn't know where I was going to live. I lived with my parents for 2 years because we were on a waiting list to get on Section 8, and there's no accessible housing in Ames without carpet. Ridiculous. Now I currently live where I'm purchasing a habitat house. It's fully accessible to me. It's awesome. I want to keep it, but I'm concerned with these changes that reimbursement rates are already low for my waiver. They're lower for CDAC, services for people to come in and helping. They are lower than what most companies
CDAC is Consumer Directed Attendant Care. It is a non-medical type service that provides cleaning, could be transportation, shopping assistance, things of that nature.
Don't use the MCOs, then I don't know where to go. Ames is a decent sized town, but I have a hard time finding services. I called a dozen places in December, and they all said we can provide the services, so it's already a problem. I'm concerned that it's going to be worse. I went back to work within 6 months after working for those. I was lucky I had a great job, and so I've been working the entire time, part-time. I would love to go back full-time if I could, but I need the morning cares and night cares and things like that, because I technically am quadriplegic, so I look like a para, and so you can't always judge people by how they look. Obviously,
possibly can, but also that first year finding a doctor in Ames so that I didn't have to come down to Des Moines just for a full. Nobody would accept me because they didn't understand quadriplegia. So a doctor had just moved to Ames in 2005, and he said, I'll take you on as long as you're willing to learn with me. And I said, yeah, as long as you'll take me, that's where I'll go. And so I'm concerned if I lose doctors. Along with what that other lady said, I had one, when I was switching over to Medicaid, I went to pick up my pills and they said it's going to be $900 for a month of pills. And I was like, what? And they said, oh, we hadn't got your Medicaid information yet. That was 10 years ago or whenever I got on it officially. So I'm concerned if I lose access to my meds and things like that. So thank you.
Thank you for your testimony. One accident away, anyone can be identified. I think you're a great example of that, and I really appreciate you coming to testify. Thank you.
Hi, my name is Kirsten Phillips, and I just found out that Medicaid for my doctor and my dentist and my foot doctor, my therapist, and also my physical for the Medicaid to go to camp. And I just want to make sure that this new company taking care of myself, and also they will stand around and oversight. Thank you.
Thank you. Now, Brian, this is Bulow. Brian, and then Glenna Clark with Occupational Therapy.
Occupational therapy for our organization as well as for our clients. I want to support the coverage of occupational therapy in the bill because some are covering and some are not covering. If you don't know, occupational therapy focuses on improving health and the quality of life by promoting participation in your occupations, your activities, the things that you do every day. We're very client focused. We look to you to tell us what you want to work on cutting costs and positive outcomes for people. So we address both the physical and the mental aspects of our clients. So for instance, we would work on self-care. We would work with our clients on their hand skills so that they could perform. Think about how many times you use your hands today. If you couldn't use them, what you would need, and that's where your OT would come in handy. We work on accessibility. We work on socialization and job skills. So I just want to give you a little case study here. There is a child, I've worked in pediatrics for almost 40 years. There was a child who was 6. He had autism. He came in for OT. We could not even test him because he was running around the room. Couldn't get him to sit down. Couldn't get him to do anything. So we started working with him. 6 months later, he could sit for 20 minutes. He could write his name. He could write sentences. He could play in the gym. He now had the strength that he was able to play up with his friends on the playground. The parents were excited because he could now go to restaurants with him and he was able to dress himself. If you're not familiar with it, there's actually research that shows that the daily living skills are more important to a child with autism than any of their symptoms, their language, or their IQ when it comes to employment and life satisfaction. So not having OT coverage is going to be really hard for families. In this child's case, what happened was that his father lost his job, and they lost their insurance, which had been covering OT, and suddenly they went to Hawkeye, which may or may not, as other people talk about, covering. So we look at all those skills that this child has learned and his ability to go on, and I have no doubt this child will actually, someday you will read about the positive things that he was able to do, but now you wonder what will happen. So I just wanted to ask again that we think about services, occupational therapy services, and the criticalness that they are for people with disabilities so that they can access our services that they have come to depend on. Thank you.
He has a speech impediment, so he just said his name. So he's saying what would happen if he did not continue with the services. So someone will have to listen to his recording several times probably to pick out what he said, or he could just leave his speech here. Thanking the committee for listening to him.
Thank you very much. I appreciate it. Lorraine Peterson and Della Mall.
I'm Delaney Peterson. I'm from Cedar Rapids, Iowa. I recently retired as executive director of the Art of East Central Iowa, where we do represent 800 individuals who mostly rely on Medicaid, as well as all the people who love them, surround them, and support them.
Two of those people were my children. My son died a few years ago, but our daughter is still alive. She's 40. She's profoundly disabled, and she lives with her dad and me. And it's because of Medicaid services. Never in my wildest dreams did I believe I would have two children with profound disabilities. We were so lucky to live in Iowa, where people care about one another, where they build supports that people can thrive and be part of a community, and she has been that, along with many, many others. We have been exemplary in the United States. We have cut ground that other people didn't think was possible, and here we are today, looking at a new paradigm. CMS has apparently approved a brand plan to become more efficient. I'm not sure about more effective, but certainly change is here. What really concerns
I would
me
question
is
the
that we have
efficiency
had
considering what efforts are today.
people that we the people elected to look out for us. We sent many of you, all of you, to Des Moines to look out for us, both in the Senate and in the House. I see that people in the Senate, both parties, have looked at this carefully and with compassion. That is not true in the House of Representatives. I am bitterly disappointed that this is not a bilateral effort to look out for the citizens of Iowa, whether they are destitute, elderly, disabled, or whatever causes them to have Medicaid. We need oversight by all elected officials of the state to look out for its citizens. I am appalled that we are not universal in our outlook for Iowans. It sends a horrible message. We just went through caucuses, and we are looking at a time where everything is very partisan. I think it's time that both houses start working together and looking out for Iowans.
I'm Della Mall. I am a home care provider, a foster parent, and I have a couple of different issues I'd like to speak to you about. I also represent CDAC providers across the state of Iowa to ask me whether union that they can belong membership to. So I receive calls from people who are providers regularly and lately more often. One of the major problems is all of the discontent about what is actually needed to continue services as they have known them in the past. I got a call yesterday, and I will turn in this program. One of the things I want this group to understand is that these agencies are privatizing other parts of the program that they're offering us out to another leg. And so I want to make sure every single one of you are aware of that, because how many times are we going to let people take funds off of this little bit of money that comes down to meet this person's needs? And when they add another link, and they add another link, and they add someone else, each one of those steps is taking funds. I don't know how they think they're going to make a profit when there's all these people in line to make money. And so this card came to my provider yesterday. You can turn it in. I felt that we had accomplished something because we felt that the CDAC providers were going to be moved forward, and so that they didn't have to sign these contracts that they had already been sent some of, and with language that no one could understand, that we were all going to be moved forward. But according to the stuff that came yesterday, is you still have to go to a website and get your stuff completed. And this is another leg to one of the agencies. So we will tell you AmeriHealth. So you've got to really be careful about all these extensions, and we want to make sure we have good representation on this board. The other thing I want to talk about is foster children. If you take a step back and we go in and we take a child out of their home, and when we do that, we're saying, we're telling that child, we're going to make your life better. We're going to offer you a home. We're going to make things consistent goes to work and you can have a future. But when the governor or the department was thinking about bringing in this change, why were they not thinking about their children? These children that are in foster care are the state's children. Why were they thinking about their children when they jumped into this thing? Because they knew their children have to have a psychiatrist, their children have to have a doctor and a dentist. They knew all that things before they jumped off this cliff. So what happened? We cannot sit back and not have representation on this board to make sure children that we, the state of Iowa, are responsible for get the medical care and stuff that they deserve. Because we would be just like a deadbeat dad who does not support his children when he's not having a job. And we take away his driver's license, we do all kinds of stuff to him. So why is the state of Iowa going to get away with this? We can't let it happen. Thank you so much for your time.
Thank you very much. The next is, yes, I can anybody statements that you have heard.
So the young man that spoke to us a little earlier, Brian, just so that we all know, he's 43 years old, and he says, I live in a home, I haven't always been in a wheelchair. At 19, I was hit while crossing the street by a pickup truck. The accident left me physically disabled. With the transition to managed care organizations, I worry about continuity of care. What doctors will I be able to continue to see? Will I be comfortable with new doctors? How experienced and how good will the doctors be? I fear the services I receive, services
reading
from
the
my case
statement
managers, my
that
doctors,
man Brian with the speech impediment read, but it would be easily understood.
Yet our lives are in their hands. They need oversight, and we need some say in deciding it.
Thank you, Senator. One accident away from any of us being there. Next two are Margaret Baber and Melissa Joan Kelly.
I really welcome the opportunity to speak today. I hadn't planned on it until I started crying so hard listening to the testimony. And the thing I wanted to urge you all to keep in your hearts is the tremendous pain and fear that this terrible change has brought to people with chronic severe mental illness. Living with a chronic severe mental illness, as someone I love has lived for 40 years, you're already beset by all kinds of fears. I remember telling somebody, why don't you try to go to sleep? And he says, it's hard to do when the devil comes out of your mouth in flames. I mean, the kind of terrifying hallucinations and delusions that people with severe mental illness suffer from make life very horrible. And to put on top of that, this prolonged period, week after week, month after month, of fear, fear, fear. I don't know what's going to happen to me. I don't know what's going to happen to me. What am I going to do? I can never pay for my medicine. You know, this adding this burden of legitimate, real fear is horrible. And so many of the speakers have talked about fear around basic survival. How can I pay the rent? How can I buy the drugs? But what I want to remind you all of is the torment that terror gives to a person who's already tormented by the symptoms of serious mental illness. and to say that I really appreciate the other speakers, and I certainly wish that if we can't eliminate the privatization of Medicaid, at least to put some serious teeth into some oversight. Thank you.
We need to make sure that I'm not going
adjourned already. I could jump in and pause. But this committee will take some more testimony in here. I don't want to capture that.
As long as they're good and they give the services and these people's dead, we can all go up to speed. For that's how the society, that's what everybody wants. Whether you're disabled or not, you want to be productive for the society. That's what I grew up as a figure. Why can't I? My brother did, mine now. So why can't I? What are you going to do? What am I going to do?
Thank you, Laura. Is there anyone else that would like to make comments? We are at the bottom of our list. So if you want to, can we close the doors to the rally has started. If you're interested in the rally, otherwise we'll continue here. But we're going to close the doors so we can hear better.
There are a couple of seats to my left.
Hi, my name is Blaine Schmidt. I wasn't planning on speaking today, but after listening to everybody, I felt like I had to. I'm a mother of a disabled child. He's 24-hour care. He has a trach, ventilator, G-tube. And like I said,
Trach is short for trachea. He has tracheotomy where he had an operation to alter his trachea in order to correct some damage or a defect. And so he breached that.
I went to school. I have college
and that
debt.
affects the speech.
$35,000. And when they decided to close their doors, that means I'm not going to be able to work. My husband might not be able to, work. One of us won't be able to work, which means we're going to have to sell our house, which means it's not just affecting, Carson, my son. It's affecting all of us. And yes, I want to take care of my son. I'm his mother, but I can't do it 24 hours a day. And there's already a nursing shortage. And when CarePro told us, they're already not reimbursed enough. And now this, because they're not getting the answers that they need. They're for profit. People's lives should not be for profit. It is hurting us. I wake up every day not knowing what is going to happen and am I going to lose my job? Sorry. But it's scary. This is so scary. And I wanted to share our story because there's not a lot of options out there. And if we don't have the help, I don't know what's going to happen. I really don't. Thank you very much.
Thank you.
Well, ladies and gentlemen, thank you for allowing me to talk. Can you hear me? My voice isn't very well.
Tell us your name and where you're
My name is
from.
Dana Newkirk, and I'm from Des Moines. And I was all of a sudden one day when I was working and taking care of my father who had a stroke and a cousin who has Prader-Willi syndrome. All her life, they're older. She's 79. He's now 82. He's in the early stages of Alzheimer's. At 47, I'm 55 now, and at 47 I woke up one day and I couldn't go out in the sun. I couldn't work at any job inside a building. because I had lupus all of a sudden, and it is very severe. And right now, to be in here with these windows open, I risk losing my eyesight. And I need an operation on my eyelid. I just had a problem where I had a direct hit because my sunglasses fell off of my face. I have connective tissue problems. I have muscle problems. I have extreme fatigue. I have thyroid issues. And everything hit me at once while I'm trying to take care of 2 people and work. I was put on the extended Medicaid. I changed my doctor and went on their doctor, and she was fairly good. And 5 months later, the state of Iowa, Governor Branstad's administration, denied me to be on extended Medicaid. And so I have to ask my 81-year-old father to pay for my blood tests, which they have to go to the Mayo Clinic because they can't seem to test them here in the state of Iowa. For some reason, their labs aren't good enough. So they go out, and we approximately pay yearly that I worked out a little over $2,900. Well, I don't have an income, so I have to ask my father, who's on Social Security, who's going through the early stages of Alzheimer's, to pay for my care, because there's no one else in the world to do it. And because I was dropped by Terry Branstad's administration, I was given 4 papers that wanted my father's, they were very long. 4 of them, they wanted my father's Social Security, how much he made. They wanted my father's house, how much that was worth. They wanted my father's pension. They wanted my father's bank account. They wanted my father's, how much his car was worth. Every bit of property they wanted me to account for. And not one question asked me what was wrong with me. And now that I was trying to seek redress, you come up with this privatized way of making money. This administration has come in here, and I'm in limbo again, and I've got 2 people that rely on me. And anytime I get sick, anytime I have an injury, and let me talk to you about injuries, folks. A lady with Prader-Willi syndrome hits people. She kicks people. She pushes people. She's dislocated my knee. She's fractured the side of my head. And nobody will take care of her. And now that the nursing homes are privatized, I can't get her into a nursing home. And they want $200,000 just to talk to me. It's real funny that the ads come on TV where they want somebody to go and put them in a nursing home for somebody that has Alzheimer's, but when I check with those nursing homes, I can't get her in there. So I had to turn around and ask her minister to step in and take this on because I had to make a choice because I got hit so bad, she almost broke 2 of my fingers over Labor Day, and I can't go to a hospital. I don't have the money to sit in a hospital while I try to take care of her and him, and I had to spend my time split. And I don't feel good a lot of times. And they can't get my thyroid medication fixed. So sometimes I'm way up, they put me way up, and other times I'm way down, and most of the time I can't sleep. And I have to be now here for my father 100% of the time, and he was a payee for her, and he made a mistake. And now Social Security is going after him because they think he committed fraud, because at the end of the year he filled out a paper incorrectly because he couldn't do the math anymore. So I just spent $900 of his money getting a lawyer to protect him, and I had to walk away from her. And I've taken care of her for 30 years. And I'm sick. And you people that are in this privatized companies are trying to make money off of our backs. And all you've done is put me in limbo over and over and over again. This is all the Terry Branstad administration has done for me and my parents. And yes, I'm angry. I'm very angry. Because I've had to be an advocate for 2 people
for many, many years, more years than what anybody could deal with. After raising a family and raising kids, a son with disability and a stepdaughter with epilepsy, I don't have to take care of her anymore because she died. And she died because she couldn't get the care that she needed. And I'm tired of this. Thank you.
My name is Mr. Van My name is Esther Van Ostenreich. I represent both a provider standpoint and on top of being the office manager and having to go through all of this NCO transition, I'm still working with clients. And a lot of them still don't have all of the information that they need. Some of them haven't even gotten their packets telling them what the options are and everything. They're scared because our local hospital and the local doctor's office.
After she finishes, I am going to go out of here to the rotunda where the rally is going on, because I want to catch at least some of that. I want to collect this person's testimony first.
And on top of that, we're now losing staff members that we've had for years, care coordinators and case managers, that most of these clients have a hard time getting to know. And now these people that they've known for so long, they're actually comfortable with have left. And people are coming in and out almost every month, changing, because so many people are leaving. They don't feel like they can trust anyone. They don't feel like any of this is in their best interest. Again, we're a small company. From the business standpoint, the payment turnaround is not fast enough. And as a small company, we don't have enough of the backup funds to say make payroll or pay the bills for our facilities and office to help get things for our clients that they might need extra help with. And it's hard and it's frustrating, and we don't have answers for them because we call and don't get anything. I get a different person, different responses. There was just an issue with our claims from the switch back over to Medicaid. And it's just hard to try and explain this to them when you don't even know. From the family standpoint, my mother was diagnosed with multiple sclerosis when I was 8 years old. And thankfully, my father works for the government as a postal worker. So his insurance takes care of most of it. Sorry. But I worry that when he retires, that she's not going to be able to get that care. And just one of the medication is several $1,000s.
That's per
my
month.
mom, thankfully, is not as bad as a lot of people could be. She's so mobile. She tried to be as active as she could. She was a stay-at-home mom and then went to work for a school district. But now that she's getting older, there's more bad days. And I just think so much of her for all that she's done despite it, because I know most days she sits me and she forgets things and she's shaky, and I want to help as much as I can, but I worry for her. I worry for both of them what will happen, because my dad doesn't have too much longer before retirement. And I'm worried that these MCOs are not going to be able to cover everything. They're not making a lot of money between the postal job and working in the school district. I'm just worried that they're not going to be able to get the care for her that she needs.
to go in there and cover the rest of those testimonies, but I wanted to catch this part of this rally before we get out of here today.
We have to speak up and speak out. We have to make the people who we elected stand up and report to us. We do not report to them. We hire them to do right by the people and live in our homes.